Well, this morning we're looking at constant knee pain and when it's time to consider knee replacement surgery.
Joining us this morning from Gundersen Health System is Dr. Mark Topolski. Good morning. Thanks for joining us.
Good morning. Thanks for having me.
Of course. So I guess first thing, what are the signs that someone may need a knee replacement?
I missed your question.
Oh, I will. Can you hear me okay? What are the signs
I can now.
Okay, cool. What are the signs that someone may need a knee replacement?
Sure, great question. So sometimes that can actually be difficult to figure out, but what it comes down to, it's really a quality of life decision. When people have had persistent and chronic knee pain going on for years, and we've tried multiple measures in terms of injections, anti-inflammatories, people use modifications like canes, etc. But when it really starts to affect their quality of life, when they're having difficulty doing the things they want to do, and a lot of times when it starts interfering with sleep, it becomes a big issue. So certainly coming in, getting evaluated, if we actually establish that they have bad arthritis, and this has been the issue, then it becomes pretty clear that they can really benefit from knee replacement.
Yeah, so how much does age play a role in whether you should have knee replacement surgery?
So it can certainly play a role, but it typically is not the main factor. The average age in knee replacement now is somewhere in the mid to low 60s, but we've done knee replacements in people of all ages. And again, it's back to that chronic long-standing disability and pain issue. And if it's really affecting their quality of life, that may be their only option at times. We've certainly done knee replacements in people in their 30s all the way up to their 90s.
And let's say someone's decided, all right, I think I should get knee replacement surgery. What are the biggest things to know ahead of that surgery?
So there's a couple of really important factors. Number one is just being as healthy as you can, because of course it's still a surgery. So we want to make sure that certain factors are controlled, such as diabetes. Certainly if they're smoking, we want to try to get that under control. Just losing some weight sometimes can be really helpful. Another really important factor is making sure that you have some help at home. It's a surgery that requires some pretty long-standing recovery, and so you're going to want some situations at home taken care of, making sure that trip hazards are removed, there's a helpful person in terms of the recovery, and then making sure that you decide on a surgeon that you are comfortable with. That can be a really important factor, because if you feel comfortable with your surgeon and the team and hospital you're doing at, it can make a big difference in the psychological aspect of your recovery.
Awesome, great notes there. Thank you so much for your time this morning, Dr. Topolski.
Sure thing. Thanks for having me.